This procedure begins with careful preparation of the surgical site, ensuring complete sterility and precise anatomical orientation.
The surgeon identifies the optimal incision site, usually in the lower abdomen, where the transplanted kidney will be placed. A precise incision is made through the skin, exposing the underlying subcutaneous tissue.
The surgeon carefully dissects through the subcutaneous fat and connective tissue, preserving surrounding structures.
Muscle layers are separated along natural planes to minimize trauma and support faster recovery.
The surgical field now reaches the pelvic region, where major blood vessels are located. The iliac artery and vein are carefully prepared to receive the transplanted kidney's blood supply. The donor kidney is kept cold to preserve function until it is ready for transplantation. The new kidney is gently positioned inside the lower abdomen, without removing the patient's original kidneys. The renal artery is meticulously connected to the patient's iliac artery to restore blood flow.
Next, the renal vein is attached to the iliac vein, allowing blood to exit the kidney properly.
Once blood flow is restored, the kidney begins to function almost immediately.
Surgeons carefully inspect the kidney to confirm healthy circulation and oxygen delivery.
The ureter is connected to the bladder, allowing urine to flow naturally. The connection is tested to ensure there are no leaks.
The kidney is positioned securely to prevent twisting or pressure on blood vessels. The superficial tissues are closed, protecting the deeper surgical work. The skin is closed, completing the surgical procedure. With successful transplantation, the new kidney begins filtering blood, restoring life-saving function.